Hello viewers, welcome to the other session of Postgraduate Diploma in Environmental and Occupational Health for MEVE 002, that is an elective healthcare sector. So the physical hazards which we are discussing in those who are facing in the healthcare sectors like doctors, nurses and paramedical staff, and also the workers, those who are working for the healthcare professionals and then healthcare organizations. In the previous class we have learnt about some of the physical hazards most important: slip, trip, fall as well as these sharp injuries. And today we are going to discuss about the electricity hazards in the healthcare sectors. But it is very interesting that how anybody can understand or think about electricity is also a hazard for the healthcare sectors. So today we are going to discuss some of the important factors and interesting features. The electricity is also one of the hazard for the healthcare sectors. So in any occupational health and safety, a hazard is commonly normally call it as a potential, any potential source, we can say that can damage or harm, that have the adverse health impacts on the human beings. So it is also a condition where workers can contact energized equipment or any conductor. So hospital is equipped with a large number of electrical apparatus. So these devices, they may vary according to the location, according to the function, depends upon the operation systems. So these devices are if it is an office or administrative counters or staff, those who are using the computers, printers as well as the to register the patients and also to meet the preparations and human resource management. That is in the one setup, that is the administration. And on the other hand, the medical devices like infusion pumps, suction machines and also physiotherapy and equipments which are used for the medical treatment. So during the operational procedures, a patient will be under ventilation machine, for example, if you will imagine that. So medical instruments like operation endoscopies, laser devices and radiology scanning machines, these are applied as part of the interconventional treatment. So large electrical supplies, they are found in the radiology department of the healthcare sectors like X-ray machines and computerized tomographies and also magnetic resonance imaging. So that is normally we can call it as an MRI. So for diagnostic purposes, sampling is run under the electronic machine to get particular biological markers like the full blood count and urea and creatinine, antibodies, some of the microorganisms as well as the culture. So working near the apparatus or with an electrical devices, we can say that these are also important factors for the electrical hazards, we can say that. So the electric for example, working near is also one of the important factor, and contact with the electrical current, that may also cause the negative effects on the human body. So the electric current that can underrun in the human body, which leads to the organ injury as well as the failure. So blast from the electrical equipment that can cause the burn, perforated tympanic membrane and also multiple trauma. So contact between human and current or blast happens when there is a defect in the device like a frayed electrical cord or damaged plug or damaged wires and also the missing prongs. So apart from this, unsafe acts by the workers, they are also increase the risk of an electrical accidents. What are the unsafe practices, we can say that? Maybe sometimes that is the holding wire improperly or multiple extension plugs and also uncovering electrical wires. And sometimes surgical smoke is also created during the diathermy, that can also trigger the respiratory symptoms or the carcinogenicity and then mutagenicity and also other sorts of infection. So a fire incidents in Johor Bahru, Malaysia, at a government hospital that killed almost 6 patients in the intensive care unit. So normally any patient, they want to come to the hospital for the rescue operations or for the treatment purposes. If healthcare systems itself is giving a danger signals, so we have to think about it. So the fire and rescue department that declared that fire was because of the faulty wiring. And then ICU is affected because of the oxygen gas are continuously supplied to the patient. So the electric sparks which are reacted with oxygen and blazed fast throughout the unit. So entire 6 members, those who are in the ICU units, have died. So the curtains and beds which are burned and produced smoke, that also delayed the fire and then rescue activity further. It gets obviously delayed. And also the staff, those who suffered with a mild suffocation because of the smoke inhalation, and almost the firefighters, they have taken almost the 2 hours to put down the fire and also manage to control the situation. So just I would like to give this type of case studies to understand, and then how the electricity that triggers the fire and then that cause the death of the patients. And the patients from the building, they were evacuated to nearby hospitals and private hospitals. And one more example I would like to give, that the Kuala Lumpur for the fire accident that is reported because of the short circuit at a forensic department store. So the electric spark that caused the plastic and papers to catch on fire in the store. So the fire and rescue team vigilantly arrived and also saved 2 workers trapped in the storeroom. So these are some of the important factors normally one can expect in the healthcare sectors. But there were no deaths or injuries were reported at that time, but the hospital team is managed to transport oxygen tanks before the fire expanded to the another storeroom. So, and then what are the other possible sources, especially for the electrical hazards or the fire hazards are concerned. So a systematic review study on the occupational hazards among hospital care system, they have highlighted typical electrical injuries which occurred during the defibrillation process to revert cardiac rhythm in ventilator fibrillation, and also the and pulseless ventricular tachycardia rhythm. So these was there was almost many reports they have given that because of the defibrillation use. So on investigation, 3 incidents they have already reported because of the equipment defects, like paddles crack, the wrong discharges. And some are improper training as well as the maintenance of the devices, that is the that means it is an accidental discharges. And some incidents were because of the improper training as well as the maintenance devices, and sometimes unexpected shock was reported in some other incidents because of the contact with the patient or stretcher during the defibrillation. That is also most important, that one. That means there is a shock for the delivered during the cardiac massage. So here it is also the they have sustained the electric shock and was unable to recover for the at about 30 minutes. So in some other incident, the massager was also thrown away during the defibrillation, that results in the neck and the back pain. So in one of the case study, that is in United Kingdom, about thermal injury among the patients during the magnetic resonance imaging, that is the MRI, that was analyzed, and because depends upon on the basis of the secondary data analysis, they have these injuries as well as the accidents have happened, that is a burn with the electrocardiography, ECG monitoring and pulse oximetry as well as the coils. So because of this will happen, most of these burn areas are the underneath the electrode. So the patients are experienced 3rd degree burns and 2nd degree burns, and others are mostly common burns, that means very casual burns. So the cause of the burn is because of the cable loop and the proximity of the cable to MRI, and also the electrode characteristic features, and these are some of the important reasons behind the burns. So and some other are reported with the pulse oximetry. So the common burn site are the fingers. Normally pulse oximetry will keep it for the fingers, and they in those cases they have experienced third degree burns also, and 50% had the second degree burns. So we never understand, and then we never thought of that pulse oximetry can also cause the electric shock, or it can also create a burns. So in MRI, if you will see the coil which is used to hold the patient while conducting the procedure. So the electrical injury as well as accidents which are also reported because of that ring. So the coils which are normally the coiled used are the cervical thoracic lumbar, that is CTL, shoulder and cervical spine and also knee. So the CTL coil that causing a burn to thumb and thigh and hand and as well as the buttock, and also shoulder and then arm. So with this also burn at arm because of the shoulder coil, and also burn at neck because of the cervical spine coil, and also the knee coil that causing the burn at the leg. So apart from this, and there are some sustained skin burn when in contact with the coiled cables. So these are some of the accidents one can expect from the healthcare sectors. So some are experienced by the acute health effects because of the surgical smoke inhalation in hospital setup. The health risks which are associated with this one is respiratory irritation and headache, eye irritation as well as the asthma like symptoms. So assisting in surgery, it is also a significant predictor of at least for the acute health effect inhalation of the smoke. And also the department of surgery role and the employment duration, and also the number of surgeries that conducted and assisted per week, all these calculations have to be understand first, and also take the preventive measures. And also electrical safety awareness also. In some research studies they have reported that the healthcare workers consisted of the physicians, we can say that, and also the technicians and nurses, and most of them admit that the licensed electrical electrician installs the electrical equipment, and some reported that electrical devices were checked randomly or sometimes frequently, and half of the workers they experienced that wires, cables, plugs and sockets were not satisfactorily placed. So these are the especially are the chemical electrical hazards which are present in the hospitals. So what type of electrical safety as well as the preventive measures which we can understand in the hospital setup. So the risk control, what is the risk control for this type of hazards? So it is an action to eliminate or inactivate the hazards, of course. So they were implementing measures like practicables during the work process to reduce the risk or to minimize the risk, we can say that, of the adverse health effects or the property as well as the environmental damage. And traditionally few types of controls are presented in the hierarchy of controls, like for any hazards the hierarchy of controls are there. That last previous class also we have seen that elimination, substitution, isolation and engineering, administrative as well as the personal protective equipment. So management workplace assessment which is evaluated according to the hierarchy. So the wiring is caught properly, and also sufficient space of electrical equipment and worker able to move freely, and labeling of the electrical equipment that can be visible. Ensure all electrical equipment which is far from water sources because of the that is a short circuit, and also remove unnecessary items or damaged equipment from the bay. Shift working can reduce the exposure to hazards, and awareness and especially the the training for the staff about electrical hazards. For example, advise the staff not to touch electrical equipment with wet hands and continue medical education on electrical hazards, as well as the in the real case scenario for sharing experiences, mock drills and also mock training sessions, and establish the occupational safety and health policy in the department, and also ensure workers adherence to items which are listed in that policy framework. Regular risk assessment to most units and check the condition of the electrical circuit and medical equipment like the cardia monitor and infusion pump and suction, ventilation, like this. And regular updates as well as the discussion of electrical hazards, the status during the occupational safety and health committee meetings. So, occupational safety health committee are the health prevention injuries, that prevention requires a holistic approach involving employer and employee. So, both parties work hand in hand to avoid accidents and also injuries, incidents that minimize or eliminate safety and health risks. So, it is the responsibility of the employee to provide a safe and healthy working condition. So, the Department of the Labor in any of the countries, they recommend a few suggestions especially to implement effective control and the prevention. So, the workers, they should be involved in the because they are the best understand the environment that creates the hazards as well as to how to control it. They can provide the inputs to the authorities. So, the hierarchy of the management that needs to be implemented and evaluated, that is a must. So, establish a hazard control plan to guide these the selection for the emergency and also non-routine activities to protect the workers, and also review new methods or the new technologies also most important that can protect the workers and more reliable and also less costly. For example, the endoscopic room that has an impact space with the television monitor, scope power supply and disinfectant and the patient's bed. So, besides that, this procedure also requires to perform by the 4 healthcare personnel, obviously, the including surgeon, including medical officer and also house surgeon and also the medical assistant and nurse. So, the occupational safety and health prevention programs among the health personnel in endoscopy room should include especially a database of the healthcare workers, like their details, job descriptions and workplace accidents are near missed. So, this type of list should be, the database should be maintained in that particular room. Though hospitals is well known for the biological hazards, we have seen that incidents, fire breakout in the hospitals highlighted that electrical hazard is the top crucial issue in the hospital setting. So, because it threatens the lives of the occupants as well as the property damage. So, obviously that cause it is highly expensive hazards, we can say that. So, because it is the hospital management definitely needs to identify a high risk area that potentially can cause the electrical injury or the incident or the accident. So, this area can be analyzed according to the usage as well as the purchasing of the high voltage machines like the radiology, operation theatre, intensive care units and endoscopic room, like that. So, electric hazards can also cause the very adverse as well as the devastating impacts in the hospital, and also the identify as the main culprit to provoke the fire. So, this has been revealed in the most of the forensic reports by the fire and rescue team. So, they have confessed the damage, the damaged wire or short circuit that had significant cause of the fire. So, that means hospitals are highly potentially to have fire because they are equipped with the fire prone materials like oxygen tanks and medication reagents for the laboratory test and also treatment with plastics, like that. So apart from that, electrical hazards can also seriously affect the workers and the patients in the ward. The severity of the condition depends mainly on the electrical factors, and also they have the accidents that can occur and the risk of sustaining at least second degree burns if we will properly maintain when in the contact with the electric current. So when the current passes through the heart or brain, the risk increase can lead to the cardiac arrhythmia and respiratory arrest, as well as finally leads to brain death. So in most of the cases, the victims needs to undergo limb amputation and live with a disability. So hospital management must take the responsibility to ensure the working conditions or environment that must be safe for the employers and clients, and proportionally and especially we can say that the employers and clients must adhere particularly to the hospital's occupational safety health policy. So like that means they follow the safety procedures and not attempting any high risk attitude. So these are the most important factors one has to understand. So especially the health hazard in the healthcare systems or the healthcare sectors, the healthcare professionals are come across the electrical hazards. So it is a significant threat in the hospital that requires sustainable assessment, and also the improvement is highly required. So the workplace assessment and also the medical surveillance systems, they are often overlooked, and also employees fail to comply with the necessary measures that have been instructed at the workplace. So this is very pathetic situation. So one has to understand that this is the most important as well as the crucial hazard for the healthcare sectors. And also the workplace assessment and the medical surveillance systems are more important, and also the employees fail to comply with the necessary measures that have been instructed at the workplace. So this is attributed, how they have been attributed to lack of knowledge regarding occupational safety and health, and also lack of awareness regarding its importance. So the consequences of the neglecting these assessments, that may definitely result in healthcare deterioration, and also we can say that low work quality, and also they may also cause the disability and impairment. So hospitals should adopt workplace assessments and also to improve the overall health of all the workers, and also along with the patients. And that leads to increased productivity in terms of quality in health services. Therefore, the recommendations which are so far we have discussed are practical, feasible, and also on the implementation of these recommendations will hopefully result in a safer and healthier working environment. Dear learner, I would like to conclude this the electrical hazard is most significant threat in the hospital setup, and also the medical surveillance systems and workplace assessment is most important for the hospital management system. If we will follow the safety guidelines, definitely we can minimize the hazards as well as the damage to the health system, as well as the health professionals, as well as the hospital property system. Thank you.